Well, eating disorders, they can affect both women and men, and now doctors are seeing more brought on during this pandemic. Joining us to talk about this important topic is Dr. Laura Saunders, a psychologist and clinical coordinator of Young Adult Services at Hartford Healthcare's Institute of Living. Welcome back.
Thank you, Lisa.
Oh, it's great to have you. Good information. Why are eating disorders on the rise, and what does COVID have to do with it from what you're seeing?
So let's think about it from the young adult perspective. They have copious amounts of time on their hands. They are missing their sports, they're missing their extracurricular activities, and they're spending excessive amounts of time on social media. And when young people do that, they engage in a lot of social comparison. So people look like they're having better lives, or they're thinner, or they're more beautiful. And there's just a lot of overall emotional emptiness going on. And what we know about eating disorders is that there's a lot about control that is involved in an eating disorder. I mean, it's, the core of anxiety as well. So we're talking about, full-blown diagnosable eating disorders, and we're talking about what I also call disordered eating. So it's not quite at the diagnosable level, but still concerning and still needs some access to help and treatment.
All right. What are some of the warning signs and symptoms of an eating disorder?
So we're looking at an excessive preoccupation with weight, an excessive preoccupation with calorie intake. It can be changes in exercise, either an excessive amount of exercise, or taking in an excessive amount of foods. We're not going to get into all the different subtypes. We know some of the basic categories of eating disorders. But it's really a disturbance in food and food intake and an overall level of pretty distorted body image and a lot of obsessiveness around kind of nutrition and nutritional intake. So it is very concerning.
Who's most at risk?
We know that young people are at risk. Traditionally, it had been more females than males that had engaged in this, but more and more males are being diagnosed with eating disorders also. So it's a disorder that kind of goes across classes and socioeconomic groups. So we really like to look at this phenomenon with young people, especially during these really difficult times.
All right. And finally, what kind of treatments are available?
Well, for young people, I often say, let's check in with your pediatrician. You have a concern, let's check in with your pediatrician, have them do kind of a basic medical workup based on your concerns. Psychotherapy really can be very helpful. Getting a nutritional consult, seeing a dietitian or a nutritional expert, and, medication if it's so warranted based on the severity of what's going on.
All right, Dr. Laura Saunders, thank you once again for being with us. Good information.
Take care.
All right, take care. And coming up on News